Hello, Dr. Mintz here. This is an abnormal kidney. Yes, I know that may come as a huge surprise, but this is abnormal. Seriously, this is severe to very severe hydronephrosis. What do you do with something like this? How can you analyze this? What can you do to determine what's likely the cause? Well, ask yourself one thing. Did this happen overnight? Did it just start 2 hours ago with severe flank pain, and is there a stone in the ureter maybe? It doesn't look like it, and there are a couple ways you can tell. One is the severity of the hydronephrosis. Usually an acute stone is mild to maybe moderate hydronephrosis, and it takes a while for it to get more dilated. Secondly, if it's severe obstructive uropathy from a stone, there's almost always some perinephric stranding. But just as important is, take a look at the cortex. You see how thin it looks here. This is very thin cortex, pretty thin. But look at the degree of enhancement. It's enhancing about the same as the right kidney, which is quite normal. You see that? And you see some IV contrast getting into the renal collecting system. You can tell it's heavier than urine, and it's gravitating to the dependent part. But look at that renal cortex, a nice clean renal cortex, enhancing the same as that on the left. No periureteral stranding. This all tells you that it's long standing chronic. So what can give you very dilated collecting system on a chronic basis? Ureteropelvic junction, chronic obstruction, chronic UPJ obstruction. And these are almost always very long-standing, congenital or acquired early in life, and they allow a certain amount of urine to pass, so they're not completely obstructive, and that's what maintains the physiologic viability of the kidney as a whole, and it acclimates to that back pressure, and that's basically why you have normal functioning renal cortex and no periureteral stranding. What can tell you that it's a chronic UPJ? Well, if you look at the coronal images, or even better, on a regular IVP, you'll see this massively dilated collecting system. Although it may be hard to see, you may not see much of it, but it comes around and it comes to a little point right there. Now, this is not a real good point. A lot of times it's more of an elongated point, but that little prominence right there, and that's probably some ureter there, coursing down here. So that is a characteristic appearance of a chronic UPJ obstruction. And in this case, I think it was an incidental finding. I think the patient had some other problem. And you can see there's some inflammation around the colon there. So chronic UPJ obstruction, a rather dramatic example